Rigid therapeutic esophagoscopy for removal of meat bolus. This video is for teaching purpose. Rigid esophagoscopy is a surgical procedure for the diagnosis and treatment of esophageal pathology. The procedure can be performed in emergency or as an elective procedure. Principles of the rigid endoscopy. Radiological visualization of the pathology. Good light source. Suction must be ready. Proper positioning of the patient. Appropriate sized scope. Insert the scope gently and under direct vision. Draw on a paper whatever is seen. Double check with the assistant. Remove the pathology or take a biopsy. Advance the scope to see the whole length of the esophagus. Withdraw the scope gently and under direct vision. The procedure is performed under general anesthesia. The surgical landmarks include the upper incisors, the hard palate, soft palate, uvula, and the posterior pharyngeal wall. The upper incisors are used as a fulcrum for the rigid esophagoscope. The scope is then advanced straight down in the midline under direct vision, with the bevel of the scope facing the hard palate. Advancing on the hard palate, the soft palate, uvula, and the posterior pharyngeal wall, keeping the scope perfectly in the midline. Advance the scope under the endotracheal tube. The cricopharynx is visualized. The pathology is usually seen here. Here, both the pyriform sinuses can also be assessed if the pathology is a tumor. The pathology is addressed accordingly. The scope is then passed further down to see the foodway till stomach in order to assess any pathology down. The scope is then withdrawn gently and under direct vision. Detailed operation notes are recorded, including any complication if occurred. Post-operatively, the patient is kept nail by mouth in observation for 4 to 6 hours. No analgesia and no antibiotic coverage is given to avoid masking of the features of injury to the hypopharynx and esophagus. Clinically, fever, breathing difficulty, and upper back or chest pain are inquired of the patient after 4 to 6 hours. A chest radiograph is done, and if found clear, the patient is discharged. Diagnostically, the rigid esophagoscopy is performed to diagnose an injury or a stricture or a tumor in the esophagus and to take biopsy. Therapeutically, it is performed for the removal of an ingested foreign body. Foreign body ingestion is more common in children. In children, the most common foreign bodies ingested are the toys. The most common foreign body ingested by children and the young adults in our community is the coin. The most common foreign body ingested by the elderly is the denture or the food bolus. In adults, it's very unusual. We have such an unusual case of meat bolus ingestion in an adult. Here is a 39 years old male patient with an impacted, unchewed meat bolus in esophagus. There are species के बारे में बात करना, लेकिन जब फुल न रोज़ी, यो पीस के न रोज़ी. This is the biggest piece.